This lecture is pulmonary embolism. Pulmonary embolism is the obstruction of blood flow by an embolus in the pulmonary vascular system. Blood flow perfusing through the pulmonary vascular system and lungs, properly ventilating, is necessary for respiration to be effective. The physiology of the pulmonary system and impairment of gas exchange plays a key part in the elevated risk of demise related to pulmonary embolisms. Thrombus that originates from the deep veins of the legs is a leading cause of a PE. The thrombi breaks through and travels to the pulmonary arterial system, which has much smaller vessels. It depends on the pulmonary embolus's size and where it goes in regards to the obstruction of blood flow and how it impacts the system and other secondary effects that can occur. This slide just shows how a pulmonary embolism occurs. So generally, there is a blood clot in a lower extremity, such as the leg, and then that clot, if a piece breaks off of it, it then travels up the vein, and it can travel it goes through the inferior vena cava and then into the pulmonary vascular system. Now, the inferior vena cava is bigger than the smaller vessels in the pulmonary vascular system, so it can travel right on through that, but once it gets into those smaller vessels in the lungs, that's where the obstruction occurs, because it gets stuck in those. And then once it gets stuck, there's no blood flow, so then it causes the tissues around there that need that blood flow to start to die from it, basically. The expected outcome and prognosis of a pulmonary embolism, if caught late, is not good. If caught early, it may not be good either. It is a medical emergency, and 50% of deaths from a PE occur within the first 2 hours following embolization. Prompt diagnosis and treatment can help save lives and prevent complications. So it's important, if you have that redness or swelling in your lower extremities or anywhere, you get that checked out, because it could be a blood clot. And if you don't get on some sort of medication therapy, that could break off and you'll have shortness of breath because of pulmonary embolism. Some risks that occur with a pulmonary embolism is long-term immobility. Patients, or even people at home that are chair-ridden or bed-ridden, and they just kind of lay there all day and they're not able to get up, whether it's due to an injury or even depression or something. Oral contraceptive use and estrogen therapy, pregnancy, tobacco use, trauma, obesity, surgery, and family history. A lot of the times in the hospital, when a patient has surgery or some sort of trauma-related incident, they are on that prophylaxis anticoagulant, and that's to prevent a blood clot from forming and then a pulmonary embolism developing from it. To prevent a pulmonary embolism, smoking cessation is very important, as well as a healthy weight for your height and your body frame. Healthy diet is also important. You don't want to be eating a lot of fast food or foods high in fat or anything that's really unhealthy for you. You want to eat more vegetables and fruits. Physical activity and exercise will help prevent. If you do leg exercises or wear compression socks, or you avoid sitting for long periods of time, that can help prevent a DVT, thus help prevent you from getting a PE. And drinking plenty of fluids. You want to stay hydrated. Water is life. Some signs and symptoms of a pulmonary embolism depends on the size of it, the location. So generally you'll have dyspnea, that shortness of breath, and then you'll have pleuritic chest pain. Sometimes patients have anxiety and or a sense of impending doom. And then sometimes patients will cough, and they could cough up blood, and they could also have a symptom of diaphoresis. And a lot of these symptoms mimic a heart attack. So that chest pain, that anxiety or sense of impending doom, the diaphoresis. So it's important that whenever a patient comes in and they have any of these, they get treated immediately to find the cause. That way they can be treated and hopefully have a much better outcome. And I'd also like to note that small emboli can be asymptomatic, because if they are small enough, they can kind of wiggle their way on through there. A big one, it would completely block off blood flow. It would be very, very dangerous. So it's important to look out for anything that's different. If you suddenly have that shortness of breath and you don't normally have it, you need to be seen quickly. Whenever it comes to a PE, they have testing criteria, and some of that is a pulse rate that's greater than 99 beats per minute. Pulse ox would be 95% on room air, a history of DVT or PE, hemoptysis, recent surgery, trauma, cancer, and unilateral leg swelling or limb pain. If the testing criteria is met, then some of the diagnostics in labs to test for a pulmonary embolism include a plasma D-dimer level. This one's very specific to the presence of a thrombus in the body. Elevated blood levels indicate thrombus formation. And then a chest CT with contrast is the principal test. A CT pulmonary angiography is a definitive test for a PE, but it's more invasive compared to the chest CT with contrast. A chest x-ray can show pulmonary infiltration, but the CT with contrast is more effective. An ABG is the measurements to show hypoxemia and respiratory alkalosis, which is common with a PE. The coagulation studies monitor therapy to make sure that the heparin or the warfarin or whatever anticoagulant that they're on, to make sure that they are in therapeutic range with the body, because if they are too low, then they're not going to break up that clot. If they are too high, they could have an issue of bleeding out. So it's important to monitor that therapy to make sure that the clotting system is responding well. Some medications and treatments for a PE include anticoagulant therapy, which is the standard treatment for prevention as well as after surgical interventions. They're initiated in high-risk individuals with no evidence of a PE as a prophylaxis. So like I had mentioned earlier, the patients that come in for a trauma incident or after surgery, they will go ahead and put them on heparin subcutaneously just as a preventive measurement. So heparin is intravenously or subcutaneously. It's usually the first line of medication therapy. Warfarin, patients usually take that by mouth. They take it while they're on heparin until they get on a therapeutic range level in their body of the warfarin, and then they are weaned off of the heparin. Fibrinolytic therapy treats massive pulmonary embolisms and hypotension. An embolectomy is the removal of the emboli, and this is a surgical intervention. And then a vena cava filter is also another intervention, and what they do is they put a filter that looks like an umbrella, and it's inserted into the inferior vena cava, and this is done whenever there is DVTs. So there is that DVT down in a lower extremity or in their body, and so they put that umbrella-like filter in the inferior vena cava, which is before it gets to the smaller vessels in the lungs, and it traps those large emboli, but it's a filter, so it still allows blood to flow through it. Some complications that can arise from a PE include decreased cardiac output, and this is when the blood volume in the patient has decreased. So you want to monitor for hypotension, tachycardia, cyanosis, jugular vein distension, and syncope. Another complication would be hemorrhage, and this is related to anticoagulant therapy. So there's always a risk for bleeding, and so it's important to assess for bleeding or bruising from around injections or the surgical sites at least every 2 hours or according to hospital policy or provider orders. And it's really important to get those coagulation studies in and make sure that you are monitoring that their bodies and they have a therapeutic level with their medications in their bodies. Some nursing diagnoses related to a PE include gas exchange impaired, cardiac output decreased, protection ineffective, pain acute, and anxiety. And this is my reference page. I referenced Pearson and a couple of scholarly journal articles.